Now, doctors have long warned about the dangers of drinking during pregnancy. It can lead to what are known as fetal alcohol spectrum disorders. But one mother whose adopted children have the condition says families like hers need more help. Sarah Neal has the story.
It's been called the hidden problem, but for this mother, whose 2 adopted sons have fetal alcohol syndrome, it's all too visible.
It is quite hard work. We went with our youngest son and he got a diagnosis. He is small in stature. He has the classic facial features of the thin lip, thin top lip, a flat philtrum. He has a wee little flap of skin here on his eye, the shape of his face. He's got a small head. You can tell him something and 2 minutes later he's forgotten it. But it was once you got the diagnosis, there was no support here in Northern Ireland.
5% of those affected by fetal alcohol spectrum disorder have those facial characteristics. For many others, it's behavioural issues, commonly misdiagnosed as ADHD or autism. There are no clear figures for Northern Ireland, but studies suggest the number affected here could run into thousands. The Department of Health says fetal alcohol spectrum disorder is difficult to diagnose, and it's difficult to determine just how much a mother's drinking during her pregnancy. But a study published in the British Medical Journal has found the UK and Ireland have among the highest proportion of women drinking when pregnant. So for medical experts, this is a growing concern.
I think it's an increasing issue, only that it's going to be recognised more. Whether it's going to increase in its prevalence more broadly is difficult to say, but I suspect once we start to look for it, we're going to find it. And then when we find it, we'll need to do something about it.
Leanne Armstrong is a specialist alcohol liaison midwife in the Southern Trust. Her job is helping pregnant women control how much they're drinking, but she's the only one across Northern Ireland.
Sitting down with that mother and discussing through when she was drinking, how much she was drinking, and a lot of the time it's offering her support. Women come in and they're panicked that they have drank in pregnancy. The majority of the time, I say, we don't know what baby or what pregnancy is going to be affected. It is so important that once that mother decides to stop drinking, she is still doing a bit. She is benefiting her baby, and it is the healthiest choice to make.
And as behavioural symptoms are often misdiagnosed, support can be more difficult to get as the children affected grow up.
100% preventable. It is the one disability that could be wiped out if people did not drink when they were pregnant.
The health guidelines are clear: no alcohol, no risk. Sarah Neal, BBC Newsline.